Now we'll move into the Foley catheter insertion. So every Foley catheter insertion, before the nurse goes in, they want to have a proper hand antisepsis. So whether that's with soap and water or the pump in, pump out with the alcohol-based hand sanitizer, they're going to do that first. And then they're going to come in and they're going to explain to the patient exactly what they are going to be doing with the Foley catheter and why they're getting the Foley catheter. So putting the patient at ease. Next step, they're going to open up this tray, and this is a good opportunity to show how to get underneath and open up the tray completely. And then you're going to pull all of the contents out. So at this point, I don't choose to have my non-sterile gloves on or my wall gloves just because I'm getting everything out and getting everything prepared, right? So you're taking everything out. You're making sure you have a garbage can, right at your feet in a very easily accessible location. Some nurses choose to take the bag and actually put it on the end of the bed. That works for some people. For me, I'm a little bit clumsy, so I'd have my sterile gloves on and I would actually go into the bag and I'd contaminate myself. So I choose to have a wastebasket close by. So they've washed their hands, they've opened up the tray, they're going to set these non-essential pieces to the side. So the stickers are going to the side, and then last but not least, reaching under here and grabbing their instructions for use. This is a good time too to go through the instructions for use with the hospital contact or the patient information, just to give them a nice reminder. Okay, so now we're going to move into the patient care. So we're going to put our wall gloves on, non-sterile gloves, clean gloves. I'm just going to don these in the usual manner. There's no specific procedure for putting these types of gloves on. Those go on after hand washing. You're still going to open the tray, maintaining aseptic technique or maintaining it, the sterile field. So, but remember, the first part of this is a clean procedure. So you're still going to open away, and then under the third fold, you will have 1, 2, 3. Under the third fold, you get your Peri Care. Okay. So, and you also have your non-sterile drape. So take note when you are pulling these things out, you're not manhandling the tray. This portion of the tray, it's kind of hard to see it. I'm going to tip it up. So this portion of the tray here is sterile. So you don't want to touch that with your non-sterile gloves. See, I put that up pretty slick, huh? Okay, so non-sterile drape is going to go down. I can touch the outside of my tray to move it away. A piece of this that is on our DFU, make sure and on your assessment sheet, shiny side goes down. You'll see a lot of variation with this. They'll not unfold it, they'll put it shiny side up. So it does go shiny side down. And the other thing you want to be mindful of is that this tray is getting moved away from your patient and from this area where you're going to set this down. Because remember, we're not considering this sterile right now. So if we place this down and it goes on top of our sterile field, let me adjust this so you guys can see a little better here. I'm sorry. There. Okay. So if we place this and it goes on top of our sterile field, we've contaminated our field. So we need to have this in a location that it's not going to go over our sterile field. Okay, shiny side down. We're ready to do our Peri Care. Start with our 3 Castile soap wipes. Open them all up. And it's okay to have these set out. This is a question I've gotten a couple of times. It's okay to have these set out onto this field because this is not sterile. Or at least I'm not treating this as sterile. So you can set these out. You can unfold them. I prefer to just unfold them a couple of times, not all the way out. So they're just like this. You see that? Sorry. Okay. This way they're not going to tear, but you still get a good amount of surface area. And now you're going to begin your Peri Care procedure. So during your setup meeting, this is a question to address with your key contact, which is what they do for Peri Care. So are they using what's included in the tray? Are they using the sage wipes? Or are they using soap and water in a basin. And what do they put down? Something else you want to address is this underpad. So once they are completed with Peri Care, or they have completed Peri Care on their patient, are they going to leave this underpad, or are they going to take it away? They may ask you what BARD recommends, and guess what? It's not in our DFU, so we don't have a recommendation. All we can do is give them, you know, a scenario. So I like to describe this as you know, I have a baby, so I like to say, so, you know, when I'm changing my baby's diaper, you leave the dirties there, and you're doing the cleanup, and you roll up the baby wipes in the dirty diaper, throw that away, and then you put the clean one down. So this to me is sort of like, you know, you might get some debris on there, but it's completely up to the account. So when you're doing your cleansing, your Peri Care, it's left, right, center. You're not going to go in haphazard, because again, drawing another parallel to a baby, especially a female baby, you're going urethra to anus, right? So top to bottom. So start out left side, and then you're going to throw this away. Right side, and throw this away. And then right down the center. And then throw this away. Okay, so at this point, my gloves are still on. I'm going to take my underpad away. And I am going to throw it in the garbage. Okay, now I'm going to take my contaminated gloves off. I'm going to throw them away. Just going to set them here though. All right.